Assalamu alaikum, brothers and sisters. My name is Dr. Muhammad Asif Ashraf. I'm a general practitioner and I've been practicing in Adelaide for the last 15 years. My area of interest is management of chronic medical conditions, and kidney conditions is one of them. As you know, we are in the month of blessed Ramadan, and it's the best time to seek Allah's pleasure by fasting, by prayers. However, Islam also teaches us to look after our health. So my message for today is specific for the patients who have kidney diseases. Now, the first important thing is that patients with kidney disease should go and see the doctor and find out what is their severity. We generally divide kidney patients into mild, moderate and severe groups. So by seeing your GP, by doing blood tests, if they have not done before, you'll find out that which category you fall in, and also need to make sure that your doctor tells you that your kidney functions have been stable and there has been no recent major changes in your kidneys health, and if the kidneys disease is also associated with any other medical conditions like diabetes, and if they're well managed. So talking about these major groups, the mild category, where we generally say that the kidney functions are more than 60%, they're considered safe for fasting. The other group, which is the severe group, where we say that the kidney functions are less than 30%, they are considered high risk. So fasting can harm their health. So we will focus our message for the middle group, which is where the kidney functions are somewhere between 30 to 60%. And after they have consulted the doctor and they be given all clearance that the kidney functions are stable, then they can go ahead. Now, when they're fasting, there are certain specific precautions which are related to the kidney's health. And we will put them in few categories. We'll start off with fluid management. Because kidneys are a very important organ, as you know, and they keep our fluid balance. So during the fasting hours, you will not be able to drink, so you have to compensate this for night time. So make sure that you have enough hydration between the hours of iftar and sahur. Secondly, please make sure that you do not consume caffeine and salty foods, because both of these things can deplete your body from fluids. Another important aspect is the kidneys control a very fine balance of minerals in our body, like sodium and potassium. So there is some advice regarding the dietary choices for that as well. We say that please avoid food with high potassium in them. The examples are bananas, oranges, potatoes. Most processed foods have certain chemicals in them which are high in potassium as well, and they should be avoided as well. So go for more like vegetables, whole grain meals. They will be better dietary choices in general, and especially for the month of Ramadan. Secondly, medications. Most of the medications that are used in kidney diseases, they can be managed with morning, like sahur and iftar. In some cases where the patient have to take extra tablets during the daytime, for example fluid tablets, then that advice will be given by your GP. If you definitely need them, in that case that might compromise your eligibility to fast. The next thing is the weather. Now, hot days can be a problem. So when you're fasting, please make sure that you're not into the hot weather, you're not sweating. That will compromise your fluid status as well. And the last thing is physical activity. Now, we say that with kidney disease, during the fasting hours, please avoid any strenuous physical activity, because that will cause sweating, that will again cause the same problem, dehydration. So in summary, important things are that you see your doctor, make sure that your kidney functions are checked, you know which group you fall into, follow these dietary choices, make sure that you avoid heat, and make sure that you take it easy. Do not involve yourself in any strenuous physical activity. Our religion is a religion of mercy, and if fasting can harm our health, then Allah has given us ease. Jazakumullah khair.